Assalamu alaikum. I am Dr. Nishat, Assistant Professor of Physiology, and today my topic is packed cell volume. Why do we determine packed cell volume? Determination of packed cell volume is done mainly to assess if the individual has anemia or polycythemia. And at the same time, we do packed cell volume to assess or to measure the absolute red cell indices, that is the red cell mean corpuscle volume, mean corpuscle hemoglobin and mean corpuscle hemoglobin concentration. Packed cell volume. How do we assess packed cell volume? Packed cell volume is measured with the help of the method Wintrove's method. In this, the blood is mixed with anticoagulant, that is a mixture of which is called the Paul-Heller's mixture, which is a combination of potassium oxalate, which is about 0.8 milligrams and 1.2 grams of ammonium oxalate. Blood is mixed with it and it's taken in a Wintrove's tube with the help of a capillary pipette. And then the Wintrove's tube is centrifuged at 3000 RMP revolution per minute for 30 minutes. And then after that we get 3 layers of fluid. That is, if this is the test tube, that is the Wintrove's tube, the bottom part of the tube is settled by the red cell, and the middle layer will be a layer of WBC and platelets, and the top portion will be the plasma. How do we assess or how do we determine the look of a Wintrove's tube, and how can we differentiate a Wintrove's tube from a Western green tube? Number one, the Wintrove's tube is a narrow and short tube where gradations are present on both sides of the tube from 10 to 0 in one side and from 0 to 10 on the other side. And both, in case of the Wintrove's tube, the upper end of the tube is open and the lower end of the bottom of the tube is closed. Whereas in a Western green tube, both end of the tube is open and the tube is quite long and it has gradation from 0 to 100 with the 0 marking on the top. To perform the PCV, we require supplied blood, Paul-Heller's mixture, which is the anticoagulant, which is a combination of potassium oxalate and ammonium oxalate, a pipette, a capillary pipette, a test tube and a Wintrove's tube. As I have mentioned earlier, a Wintrove's tube can be recognized from the other tubes as it has gradation on the both sides. In one side it is from 0 to 10 on top and the other side is 10 to 0, and only the upper part of the tube is open whereas the lower part is closed. Firstly, we have to take the Paul-Heller's mixture with the help of the pipette . We have to take around 0.2 into the test tube. Then we take the supplied blood, about 2 ml. Then we mix it. Then with the help of a capillary pipette, we draw the mixture, the oxalated blood, and we transfer it into the Wintrove's tube up to the mark 10. And then this is centrifuged. After centrifuging it for 30 minutes at 3000 RMP, we get this picture, that is the bottom layer is settled by the red blood cell. Since it is heavier than plasma and the other cells which are present in the blood, it settles at the bottom, and the middle layer is a mixture of WBC and the platelet, which we call it as the Buffy coat, and the top layer is the fluid layer, which is the clear plasma. This is how we assess the packed cell volume, and then we take the reading of the red cell of a higher limit from the 10 mark. Then we place it in the formula, we calculate PCV, that is the height of the red cell in millimeters by the height of the whole blood into 100. If suppose the reading comes to about 45 and the whole blood is about 100 into 100, then my PCV will be 45%. After we get the reading, we have to assess whether it's within normal value or not. The normal value of PCV in case of male is 42 to 46%, whereas in case of female it's about 32 to 42%. So we have to say that the PCV is within normal range. Thank you so much.